Can't beat that combination. Woohoo! Oh boy, D. Ryder's going to be on this video hardcore. Love to great men about to debate. All right, let's debate. Dano, you guys, so it is healthier to be cooler than hotter? I think it's healthy to be in the middle. Throw that curveball, you little zen at you there. You know, really, the middle is the balance. You know, like a teeter-totter. Here's cold, here's hot. Everything in the middle. Consciousness, you know, everything in the middle. You know, the middle path. Buddha talked about the middle path in his work. And basically he was saying, don't jump on either side. That's duality. You want to know what consciousness is. And, you know, people are coming around, that's for sure. But I hope I've given you enough tools to debate with. I'm going to keep giving you a bunch of tools to debate with because, you know, you can't get around the fact of the design of the human body, both anatomically and physiologically. You can't get around that. You can't go and judge what man's doing and say that's what we should be doing, or what he did 1,000,000 years ago, that's what we should be doing. Get away from that kind of crap thinking. You can understand that man did some journeys, and the journeys weren't absolutely the way. I mean, he did them, and you can say, well, that's the way it should be. Absolutely. But how is it then that we have to get up to these high level of fruitarian diets to cure anything? I mean, to really have a good cure. And this is especially true, remember, neurologically. You're not going to cure yourself neurologically on vegetable matter very well, I guarantee you. Been too many years doing it. So I can just tell you that when you see the level of fruitarian sometimes you have to be to get well, some of you advanced cases, you start to realize that when you step down from that, you won't feel as well, but you'll still feel healthy and good, but you'll never feel as well as a fruitarian diet. There's just nothing like it. Not advocating it, but I'm saying that in the future our young people want to be frugivores. They want to work themselves to fruitarianism, and we want to have the fruits to feed them. Now you're going to have a mega high-level consciousness planet, but not sure that that's dubbed this planet's for that, to be honest with you. Most people that are elevated themselves, they generally take off and leave and go on to their next adventure, been done with this place. So I don't know. You know, I have no judgment there with God, you know, whatever you want this place to be, okay. I'm just here as a channel to help bring out love and health, peace, you know, all that good stuff. Why is cinnamon bad for us? I don't think cinnamon's bad for us. I use cinnamon all the time, especially for digestive problems and inflammation, especially in the gut. When people call me, good for blood pressure and blood sugar. I don't know why people would find cinnamon bad. I don't. One low blow, Dr. Morse forgot to mention, I've had two, count them, 2 VT ablations, and they are talking about wanting to do another. Well, you know, I suggest you get a heart implant. No, you know what, get your parathyroid up, get your adrenals up, keep moving that lymph, okay? Just keep doing all those things. You need to get calcium utilization going. You need to get your adrenal neurotransmitters up. That gets the autonomic nerve up, strengthens the myelin sheath. Of course, calcium utilization also brings the nervous system in proper function, particularly in the heart. If the nervous system in the heart is being suppressed by the lymph system. Now you see this when you're real tight in the shoulders and stiff and sore, you can start getting numb fingers. Same thing in heart, same thing anywhere else. Swelling is a product of acidosis, and then hardness and that sort of thing, and that can impress upon blood and lymph, blood and nerve flow in any tissue. So it goes back to the lymph again. So it's just getting that lymph under par. You can use herbs and things to rebuild nerves, to rebuild other things, but you really have to address the biggest causative factor we face, and that's the lymph and acidosis. Handle that, and then you can rebuild any tissue that's genetically compromised or whatever. You can deal with that much better. Because if you're trying to rebuild a heart in an acidic medium, or you're trying to rebuild a nerve flow in an acidic medium, or you're trying to rebuild liver tissue, brain tissue in an acidic medium, good luck. You know, you're going to be slow, and the progress will be slow. You could get progress, though. I've seen people slam the herbs and get progress even though they half did the diet. But in reality, moving that lymph is everything to getting this acidosis or inflammation out of these areas so the body can rebuild these tissues. Then you can help these tissues accelerate their rebuilding with specific herbs. That's the end thing, and all modalities need to come up with us and sit around and join us at the campfire, and let's kick some butt on this planet and make it a good place to live now. There's too much hate. Governments just step aside. This government's just got to step aside. All governments are just gotten too dictatorial, too we know everything and the people don't. You know, it's just that same thing as the king's taxing people to death until the people killed the king. And that's what's happening. People can keep paying more taxes. I can't imagine a party, a Democratic Party, even being in existence with the concept of spending more and taxing more. I can't imagine anybody voting for anybody that thinks that way. And that's how low of a consciousness half Americans are. Jesus. You can't believe it. Ron Paul, man, you're doing well, son. You're a little old, but get your health together because you could change the whole planet. You'd be a heck of a guy to do it, man. Throw your son up there. You know, I wish his son had ran. He would have won for sure. He's such a nice guy. One low blow 3. Thank you for taking the time to read my questions. Short history, 48-year-old male, cardiomyopathy, VTAC. Oh, is this a product of the other one? Well, this young man has had cardiomyopathy, AFib, which is atrial fibrillation, where the atrium of the heart's disfibrillating, and hopefully you get enough beats to the ventriculars to open up and move blood through the tricuspid and stuff. But then you got VTAC, means that's ventricular tachycardia. That means these lower ventriculars of the heart is racing. VTAC is what you see when you're about to have a myocardial infarction or you're about to go down with a heart attack. Not good. That's not good at all. Heart blocks. Okay, you have first degree, second degree, third degree heart blocks. Not good either. And that's when you start seeing your beats getting further and further apart. I saw a 6-second heart block once. I used to do EKGs and stuff, and I saw a 6-second heart block. You talk about freaky. Oh man, combo pacemaker defibrillator. Now, I can see why. Paced 100%. Holy crap! That means his atrial fibrillation isn't, meaning his atrium, which is the top chamber in the right. It's just sitting. That's where what they call the SA node, the sinus node. You get that electrical impulse that opens up that valve. Well, when the SA node, maybe a lot of acidosis from lymph and all that's breaking down that SA node, but you're getting firing all over the place in the atrium instead of from the sinus node. So now, if none gets through and dilates that, opens up that valve, you don't get any blood moving down into the ventriculars, down to get back to the lungs to get oxygenated. So you wouldn't be oxygenating your blood. And then you would be backing up your venous system, which has some degree of acidosis from the collection of some stuff. So yeah, big problem. His heart rate is so low he has to be paced. Most pacemakers are set at 60 heart beats per minute. His ejection fraction is 35%. Chronic anxiety, PTSD, deadly afraid to be shocked by device. No kidding. That's cardioversion there when they, the paddles, clear, had a lot of that, well, that's what you do to cardiovert someone from AFib back to sinus rhythm, normal sinus rhythm. Down 25 pounds from 205 to 180 in 2 months. No meat, dairy, bread for 2 months. 2 fruit meals day going on 3rd week. I take your nerve, brain, lymph 1, adrenal, kidney herbs. Have appointment with you in April. Biggest problem is I'm very short of breath with minimal exertion. Thank you. Please help. Oh man, holy crap. Okay, first of all, I would suggest doing this. Get into the 3-lung tea. Take the lungs 2 formula. Now that's just going to start cleaning out the lungs. This is an oxygenation problem. I realize that. You really want to get on the kidney formulas. You want to get on the adrenal gland formulas. I would say probably you might want to do both, a desiccated adrenal glandular and the adrenal gland. Depends what your blood pressure is. It could be high with someone with a kidney weakness and adrenal weakness at this level. Could be high. When it's down, you can take the herbal adrenal thing. Just definitely work on the parathyroid. You need calcium utilization very, very bad. So you want to get that up. Move lymph, get your calcium utilization up there. Very important. Again, get your adrenals up for the autonomic. That's the nervous system that deals with the heart. Get your kidneys up, of course. Get that lymph filtering. Move that acid out of your tissues here. At the same time, I want you to clean your lungs. Also, work on your GI tract. This is the autonomic nervous system. This is a creator of many heart problems, is your gut. So you want to clean your gut up, your GI tract. You really want to work on that. Work on the lymph, and you'll pull yourself out of that. Get on the raw, get on some green drinks and stuff like that, and start moving that lymph. I'd also recommend circulation lower. We take our heart formula, it'll strengthen the heart muscle. It's good for arrhythmias, and work in that way, and you'll be okay. All right, you got a lot of things going on here, man, but you've got to go to the endocrine glands first and clean up the lungs, clean up the bowels, clean up the kidneys, get the lymph moving, get those adrenals up, and you'll be okay. You don't have to fear. We're here for you, man. So call up Jennifer and have her help you here if you need it, because pretty serious case here. You'll be okay, man. Love the vids. Could you do one on salt, good or bad, types, etc., etc.? Oh, 6-string. Well, you know, we try to push the Celtic, Himalayan, or real salt. Obviously, a robust salt. There's been wars fought over salt, of course. The sodium chlorides of regular table salt and sea salt, not into those kind of salts. You don't need to overdo the sodium and chloride issue. Not at all. You can use it as an alkalizer, but not really. I mean, we throw people with skin problems like psoriasis in the ocean out here, of course, really helpful in that way. So saltwater baths are very helpful to skin problems and alkalizing. You know, sodium's a good alkalizer, but remember, you want to do it the right chemical way where you're bringing in all the family members so the body can utilize the way it wants to. The adrenal glands, of course, is where you're going to go for sodium-potassium balances, so that's important. And, you know, I would do minimal. If you have a salt desire, you know you have adrenal weakness. If you crave salt, that's straight up adrenal gland weakness. I would shift that. If you have to have some salt in your life, I would shift to seaweed if you can. Dulse or kelp would be a great substitute for salt. If you can stand that taste, then by all means I would go to kelp for sure. I mean, now you got extreme power food. Kelp is a superfood, and that one would be highly advisable. Matter of fact, it'd be advisable with that the gentleman with the heart issues, particularly for bringing up the thyroid and parathyroid gland. I'd be interested to do your basals and other checks on you, man. But anyway, I like Himalayan, Celtic salt, real salt. They're all, you know, all these salt lamps. I had a lady in yesterday from the Salt Cave in Cape Coral, Florida. She has a salt cave. I forget how many tons of salt she said, but it's pretty good stuff. So all that's helpful. You know, we run salt lamps all in the office here. We don't know. I mean, we can tell there's salt being broken down, so maybe it helps to alkalize the air a little bit. Who knows? You know, a lot of claims on everything, but you know, but I like them. They're pretty. But still, I wouldn't overdo the salt, though, to be honest with you, but I'm not opposed to some robust salt, meaning heavily mineral. And Celtic salt, I've seen the stats on that, and that's got all the traces and micro traces in it. A little grayish-looking, darker salt because it's more minerally robust. So I would go that way. Hi, 6-string, how you doing? And I got to pull off of here because I'm now appointment time's coming.